Today we're gonna discuss multiple topics, including hazard ratio. We're gonna explain what does it mean, hazard ratio, and we're gonna try to highlight how to answer a question while you have an abstract. So abstract, it's a study that you will have next to your question on the board. Like let's say this is the vignette for the question, and you have here your multiple choice. You will have an abstract next to the question. The abstracts, and it will include usually a study and tell you the method, the numbers, and will give you the result here, and it all as usual as well. It would have a figure in the bottom or in the top, whatever, like this one here. Let's read the question. So here it's a 40-year-old African American. His blood pressure blah blah blah, pulse and his serum potassium. I'm skipping these line, the one in the yellow highlighted, and I will tell you why. So his serum potassium is 3.9, estimated GFR 36, his baseline creatinine 0.20. Now look, usually the question vignette, it's long. It would tell you like he has strong family history, or his EKG showed this, and he's feeling tired, he's feeling fatigued, he has a blurry vision. This is not the question. They're trying to distract you. Try to train your eyes and yourself to pick up the key words. So the question asking the significant part of the question start here. Which of the following factors on follow-up will most significantly increase this chance of hyperkalemia? My next advice to you to read the choices after you have a grasp on the question. I'm gonna read the answers one by one, and will tell you why the right answer is this or that. So the first choice is addition of the calcium channel blocker. This is what increases serum hyperkalemia over years. Addition of thiazide diuretic, discontinuation of metoprolol, follow up serum potassium level of 4.7 as compared to the baseline, follow up creatinine of 1.1 as compared to the baseline. I will not go through the whole abstract here. I will leave it for you to read it, and I will attach the link, and it's available on PubMed. Anyways, I want you to look at this paragraph here. So if we looked at the first choice, which is addition of calcium channel blockers, look at the figure here. You have two figures, or one figure and table. The first figure is telling you the event rate per 100 patient dash years. So every set of years you have events, like let's say this is after etc. Let's say this is after 3 years. We have this much of hyperkalemia. This is after 6 years, we will have this much of hyperkalemia, and so on and so on. Each of these bars represent the drugs. Now you're gonna solve your question usually not with this. Usually you're gonna solve your question with this table. The whole question evolve around this table. Now if we pick first one, which is calcium channel blocker, if you look at the figure here, we have amlodipine, which is the calcium channel blocker, and the bar of amlodipine is the lowest bar to have hyperkalemia. So we have metoprolol, ramprel. If you check the bars, you would see that the calcium channel blocker, which is amlodipine, has the lowest one among all. Check out their GFR. So the patient who have hyperkalemia, less than, when their GFR less than 30, and they are on calcium channel blocker, it's so and so, and patient who have GFR less than 30 and or more than 30 to less or equal 40, they have this much of hyperkalemia. Now remember, in the question they can manipulate it. They might give you an answer looks like this. Would say patient on calcium channel blocker will have lowest hyperkalemia. This can be a correct answer. Now, on that premise, answer A is wrong, because patient or adding a calcium channel blocker for this patient will not lead or cause hyperkalemia. So first answer, first choice, we excluded based on looking at this picture or this figure. Now let's move to the rest of the answer. Before I move to these answers, let me explain what is it hazard ratio. Hazard ratio simply is the people who were exposed to the treatment or to the poison or whatever. So the one that exposed over the one unexposed. Now, let's say I have patient who have hypertension, and over a period of 5 years, I want to see if they will develop hyperkalemia or they will not. So let's say I have patient and they are exposed to ACE inhibitor, and this one non-exposed to ACE inhibitor. The one who are exposed, let's say that the one who exposed to ACE, the number of these people develop hyperkalemia are only one, while the one who did not exposed to the ACE inhibitor, they will develop hyperkalemia over a period of 5 years will be 10. Now, the hazard ratio will be 1.10. Any number that hazard ratio give us less than 1, that's means a treatment group has lower incidence of developing a disease. It's very obvious, and vice versa. So if the hazard, or my hazard ratio, was more than 1, that means let's say I have I have patients. This is hazard ratio. It's not human resource, not HR. It's a hazard ratio. Who took beta blocker, and they develop chronic kidney disease. The number of these patients were, let's say, 10, and the one who did not take beta blocker or took a different kind of medication was 1. So my hazard ratio is 10. So it's more than 1. If my hazard ratio is more than 1, that's mean the exposed group developed or the treatment group developed an incident more than untreated group. This is untreated group. Let's go back to the answers and compare them to the table. Addition of thiazide diuretics. If you go to the table here, you would find this. You have to look up for groups or your hazard ratio that took diuretics, which is this. And remember what we said about hazard ratio. If it's less than less than 1, that's mean my untreated group developed the incidence more than the treated group. So those people had more hyperkalemia than the exposed group. So this answer is not correct, and it should be excluded. And actually, the p-value is 0.06, which is the p-value is way less than 1, which means it has significance. Remember, if my p-value is less than if the p-value is less than if the p-value less than 0.05, that's mean my study it has a value and significant value. I will explain later that in different video what does it mean less than that. But anyway, I want you to memorize this. Since my p-value it has this significant, that's mean giving diuretics it has will not lead into hyperkalemia, and my p-value support that. Anyway, so B should be excluded as well. Discontinuation of metoprolol. If you look to the figure here, now, if you look to the figure, metoprolol, the bar of the metoprolol, I will color it for, so it would, I will put it in green. This is metoprolol. This is metoprolol. What do you think, the bar? Which one has more hyperkalemia? When the GFR less than 30 or more than or between 30 to 40. By the way, this is like telling you it's between 30 to 40. Here it's saying less than 30. Which one do you think of these bar has the highest hyperkalemia? Of course, the white one. So do you think that taking metoprolol and I would follow patient by taking metoprolol only to check hyperkalemia, that would be helpful? Of course not, according to this figure. So that would exclude this answer. It's better to highlight it with different color, or I'm gonna just cross it. Okay, so again, checking metoprolol or I'm sorry, if discontinuing metoprolol will end the patient with less hyperkalemia, that's incorrect according to this figure. This figure telling me patients who are taking metoprolol, they would not by necessary having hyperkalemia, even when their GFR between 30 to 40. This is really low, and this is almost CKD, one of the stages, maybe third stage. So as far as I remember, so discontinuation of metoprolol here would not make the patient significantly, will not change the outcome. So this will be excluded as well. Now let's check D. D says follow up serum potassium. Okay, so here saying serum potassium. Let's see. Do I have any serum potassium on this figure? No. It's only drugs and GFR. Do I have here serum potassium? Let's see. GFR here says here's a GFR. Here's creatinine and creatinine. Oh, I have creatinine and I have here potassium, serum potassium. So let's match the answer with my table. So I will not look at this. I will look only to this. Follow up with serum potassium level of 4.7. So in this study, the association of risk of hyperkalemia with time-dependent factor in multi-variable analysis, which reported, remember here, as hazard ratio. Remember we explained that. The factor or the hazard ratio that has potassium levels include the 4.7. My 4.7 here is the one that potassium level of that's fall between 4 to 5 versus less than 4. So my 4.7 fall in between 4 to 5 levels of potassium versus less than 4. Now this is the only one that has high hazard ratio. Remember, hazard ratio, patient who are treated divided by patient who are not treated. This this is the number. This is the highest number I have. So the answer is. So in brief, the answer is that if I will follow patient with serum potassium level is 4.7, okay, 4.7, with the already mentioned criteria in the question. So if I have patient who is African American, who is hypertensive, who is GFR so and so, and his potassium 3.9, the only answer is that, in a brief, that's explaining my answer. That's if I would follow that patient, and if he developed 4.7 number of potassium, this will determine his hazard ratio for hyperkalemia. Because if I will look to the table here, I would find that the only group who had high hazard ratio and their potassium level were between 4 and 5 and less than 4, 4 to 5 and less versus less than 4. Again, the hazard ratio here, it's 4 to 5 versus 4, and my potassium level is 4.7, so it falls in this particular level, in this level. So my hazard ratio is 7.25. Remember, the question can be changed. It would probably ask you, what is it the associated hazard ratio with potassium level, this number, or it can change what's the p-value. It would ask you about the p-value. So it has other avenues to ask you about. Now the last one I want to talk about, it's telling you follow up with creatinine 1.1 as compared to the baseline. If you're gonna check here all the creatinine, if you see all the creatinine here, I have creatinine less than more than 0.08 and less than 0.20, creatinine less than 20, I'm sorry, here versus here, and here versus this. So I have two parameters here. Now the one that is given to me, it's 1.1, and also this one. So my 1.1 would fall here. It's between more than 0.66 versus less than 0.08. Remember, my value here for the creatinine is 1.1, so it would fall more than 0.66. Now, if you check the hazard ratio for that specific range, it's 1.84. Compare 1.84 to 7.25. Which one has the highest hazard ratio for hyperkalemia? Of course, it's a matter of which number is bigger. This is the bigger number. So the last answer should be excluded, and it's not the right answer.